Assalamu alaikum. I am Zahra Al-Belushi, IV therapy instructor. Today gonna present IV therapy complication and its management. So the objectives for this lecture will be: you will be able to identify and analyze key risks associated with peripheral IV therapy, identify measures to reduce IV therapy complication, consider the wider issues and risks relating to peripheral IV therapy and nurses' role. Also, you have to identify each type of complication and describe them according to the following: definition, causes, signs and symptoms, and nursing intervention. Complication of IV therapy. As you know, IV administration has been an essential component of the care of hospitalized patients since 1940, when some hospital in the USA has designated one nurse to assume the role of IV therapy. So as a development in IV therapy has progressed, also the role of IV nurse has similarly expanded. By the 1970s, IV nurses were performing functions that previously were done only by medical staff. Today, more than 90% of hospitalized patients receive some form of IV therapy. And when the patient leaves the hospital, they may not remember such things like the room they were in or the name of test performed. Most, however, recall their needle stick. So a proficient IV nurse will minimize the anxiety and pain associated with this experience, and also will try to minimize the complication of this procedure. Taking care of a patient with an IV line involves consistent monitoring to ensure that the pathway remains accessible. So failing to do so can lead to delay in the treatment and damage the vein, and it will end up with some complications. Intravenous therapy is commonly used in hospitals. More than 70% of patients admitted to the hospital will require IV therapy. So in spite of this extended use of IV therapy, still there is some complication are occurring for some patients, for example like phlebitis, infiltration, extravasation, or other complication, which will result in increased hospitalization time, treatment cost, and also it will increase patient discomfort. So it is crucial to understand the risk factors for developing these complications, which can lead to facilitate the task of daily care of the nursing team, and this may help to produce knowledge and scientific evidence to support the decision making of nurses in regard to minimize the risk of peripheral IV therapy complication. So we can classify the complication according to their location. So we have two types: either it can be local complication or systematic complication. So when we are saying local complication, that means the complication which is occur at or near to the insertion site. Whereas when we are saying systematic complication, that means the complication that occurs within the vascular system. It is remote from IV site, but this complication can be very serious and it can lead to life-threatening. There is two main things to prevent complication. First one, monitoring. If you will keep monitoring your patient, once you will start the IV therapy for the patient, of course the complication will be reduced, as you will identify the signs and symptoms of complication from the beginning, and you can remove the cannula before that complication extend and it will be severe for that patient. Another thing is your technique. If you will perform a good venipuncture technique, then that means you will prevent some complications which will be discussed later. So again, I will emphasize on the type of complication. We have local complication, which is any signs and symptoms occurring at or near the insertion site, where systematic complication, it is symptoms occur in the vascular system, and it can affect the whole system, and it can be very serious and lead to life-threatening condition. Intravenous therapy is commonly used in hospitals. More than 70% of patients admitted to systematic complication can be like anaphylaxis reaction, so in spite of this extended use of air embolism, circulatory overload, speech shock, or for some patients, for example, like phlebitis type, infiltration, like extravasation, definition, or other complications, and how to manage this, which will result in increased hospitalization time, complication, treatment cost, and also it will increase patient risk more about them. So it is crucial to understand the risk factors in local complications, which can lead to facilitate the task of daily care of the nursing team, and this may help to produce knowledge and scientific evidence to support the decision making of nurses in regard to minimize the risk of first we'll discuss about IV therapy first systematic complication, which is anaphylaxis reaction. So we can classify the complication according to their location. So we have two types, either it can be local complication is a severe, or systematic complication. Allergic so when we are saying local complication, that means the complication which is occur at or near to the insertion site. Whereas when we are saying systematic complication, that means the complication that occurs within the vascular system. It is remote from IV site. What we mean by shock, that the patient his blood pressure will drop suddenly, and it can lead to and he may develop airways narrow. There is two main things to blocking of his breathing. First one, some signs of symptoms like rapid weak pulse. Patient may develop like skin rashes, nausea, or vomiting. Of course, the complication will be reduced. So anaphylaxis reaction, it can range from identify skin reaction signs and symptoms of complications from the beginning. So you have to be very cautious when you are administering any type of medication. You have to be severe for full history from the patient. Another thing is to your technique. If the patient has an allergy to any type of medication, then that means and also you have to have a look on patient file and see if the patient has an allergy to any type of medication. I will emphasize on that type of complication. We have local complication, which is any signs and symptoms occurring potentially any substance can cause an allergic reaction. Where systematic complication, it is there are multiple possible triggers in the vascular system, and it can affect the whole system, and it can be very serious and lead to life-threatening in adults are drugs or IV therapy medication. Even in pediatric, we have to take extra precaution. Some of these drugs can be like opioid medication, antibiotic medication like penicillin, vancomycin, also non-steroidal anti-inflammatory drugs can cause some reaction, anesthesia medication, muscle relaxant, and even aspirin. Because features of anaphylaxis are not consistent and are highly variable from patient to patient, together with the fact that they are not specific to specific symptoms, so the diagnosis always will be difficult. Reaction to intravenous substance are very rapid, whilst those occurring as a result of oral medication can be much slower. So when the symptoms onset is rapid, it is thought that the event will be more severe. Initially, the patient will often develop an urticaria type rash with itching and redness along with rhinitis. But when the reaction is more serious and the airway are involved, there may be breathing difficulties with wheezing, as well as air swelling, breathing difficulties, wheeze, cyanosis. Sometimes it can lead to hypotension and reduced capillary filling, which will suggest an impending severe reaction. And the patient may have a feeling of impending doom until collapse occur and they lose their consciousness. So what are the strategies to reduce the risk of anaphylaxis reaction? First of all, you have to ensure that a detailed patient history is taken. You have to ask the patient if the patient is having any type of allergies to food, to medication, or even if the patient is a known case of asthma. Why asthma? Because this type of patient, they are at high risk to develop a reaction to IV therapy medication. If the patient is a child, you have to ask the mother or the father or who's ever attending the child if the patient is having any type of allergies, and you have to take an extra precaution with pediatric patient. Also, you have to take extra precaution with some type of medication already I mentioned before, like opioid medication or antibiotic medication. So if you want to administer this type of medication, you have to start infusing it in a slow rate and keep your eyes on patient. Monitor the patient, see if there is any signs and symptoms will appear on the patient. After fully administering the medication, stay with the patient for a few minutes. Make sure that the patient is not having any type of allergy, especially if this is first time the patient is taking this medication. If you are busy, then explain to the patient or to the mother or attendant of a child. Explain for them what are the signs and symptoms you are expecting to appear after this type of medication. Like, for example, tell them if you will have any type of itching, if you will have nausea, if you will start vomiting, abdominal pain, if you will have shortness of breath, if you started to sweat, all these like signs and symptoms of reaction. Then they have to notify the nurse immediately so that you will take an fast action. Second things, you have to have a look on patient file and make sure that nothing documented like a patient is having allergic to such type. Sometimes it won't be recorded in patient file, but if you want to give a patient medication, the patient will say I'm having an allergic. You have to listen to the patient, inform the doctor, and try to take an action. I used during IV therapy course to tell a lot of cases that we witnessed, but because of short of time and online course, so we are only emphasizing on important points. Just I will tell you about one story that I witnessed in A&E. One old mama, she came with a history of epigastric pain, and doctor prescribed for her Zantac injection. Immediately the mother, she said, please don't give me that big syringe. Last time I had a reaction against this type of medication. So the nurse prepared the medication and she was about to give the medication, and old mama again informed her that she is having allergic to this type of medication. She means Zantac. The nurse informed the doctor, but the doctor he was refusing or insisting to give her Zantac, and he reported that never happened, like a patient will have a reaction against Zantac. So he was insisting to give her, and they gave her the Zantac injection, and you won't believe, immediately the patient, within half an hour, she had some symptoms like a reaction, and we had to manage her very fast because she started to have like shortness of breathing and started to sweat, and we managed that case. But as I said, we have to listen to the patient. Okay, we have to listen to the patient, and once you noticed a reaction happen, you have to report that reaction. It is very important to be reported and to be documented in patient file, so that won't happen again for that patient, and the patient won't be the patient will not each time explain for healthcare provider that I'm having a reaction against this medication. No, you have to inform the doctor, and also you have to inform the pharmacist, and I think there is one form it should be filled by the doctor if the patient have allergic to one type of medication, and later on it will be labeled, or there will be an alarm in patient file. Once you will open the file of the patient, it will alarm you that the patient is having allergic to such medication. Second things, consider administration route and rate of fluid. As I said, IV therapy or IV route is more likely the patient will have a reaction, but for oral medication, the patient will be at low risk to have a reaction. Rate of fluid, also this is very important. As I said, if you will start any type of medication, start it in a slow rate just to make sure that the patient will have no reaction against this medication, and if the patient will be fine, then you can change the rate and put it as normal rate. Identify patient with known allergies. This is already I mentioned, either by asking the patient or attendant or by checking patient file. Ensure good knowledge of the medicine. This is very important. You have to update yourself about high alert medication, and you have to read this policy actually, which is high alert medication. There is some type of medication which is kept in a locker and labeled in red. You have to know about this medication and why it kept separated away from other medication, because if you read the policy, you will find out that this type of medication, it is like giving a reaction, like a life-threatening reaction. Okay. Second systematic complication we'll discuss is speech shock. So what we mean by speech shock is a systematic reaction that occurs when a substance which is foreign to the body is rapidly introduced. Speech shock is a less common complication of IV therapy, and one that can be avoided with foresight and knowledge. It is more of a hazard when administering IV therapy using bolus method. So in order to avoid a complication of a speech shock, it is essential that IV therapy is administered at the prescribed rate. Speech shock can occur even if you are introducing a small amount of fluid, but in a rapid way. So, how you can identify a patient with a speech shock? You can identify if the patient have onset of symptoms that is associated with IV therapy or infusion. So what are these signs and symptoms? You will notice flushed face. The patient may complain of headache, tightened feeling in the chest, and later on you may notice patient is having tachycardia, his blood pressure is decreasing, and these are signs of shock. Weak rapid pulse, patient can have a cardiovascular collapse. So what are the preventive measures? You have to ensure correct rate of flow and no specific flow rates of a drug, and also you have to use electronic pumps to ensure accurate rate of flow. Also, when you want to introduce infusion to a patient, started with a slow flow rate, then you can increase the flow rate as ordered by doctor. So what is your intervention in case speech shock happen? Immediately you have to terminate the medication and notify the physician. Start to monitor vital signs of the patient. Keep all the emergency medicine at hand, and carry on the doctor orders. And the most important things, you have to document your notes and observation and the action, and then you can fill an incident report also. Your intervention in case speech shock happen, immediately you have to terminate the medication. Third, systematic communication is circulatory start to monitor vital signs of the patient. What we mean by circulatory overload, emergency is overloading the circulatory system with carry on excessive IV fluid, which will cause increased blood pressure and central venous pressure. Your notes and observation. So, inability of the patient's cardiopulmonary system to handle this amount of transfused volume will cause cardiogenic pulmonary edema. So, what are the signs and symptoms you will notice in the patient? First of all, while you are auscultating patient chest, you will hear lung crackles. Plus, you may notice edema. In pediatric, you will notice weight gain, abdominal distension. Maybe the patient will complain of shallow respiration with increased respiratory rate. What is nursing implication in regards to circulatory overload? First of all, you have to use infusion pump or syringe pump whenever that's possible, and take extra precaution with pediatric. We noticed that in A&E they are not using syringe pump or infusion pump while administering IV medication for pediatric patient, and because of lack of knowledge of parents, we noticed that the mother will increase the flow rate because she is imagined that if I will finish the fluids, then I can be discharged from the A&E. So we have to explain to the mother that she should not increase the flow rate, and we should explain that if she will increase the flow rate by herself, this can cause extra load on the heart and can lead to a complication of IV therapy. And also you have to keep monitoring your patient, especially pediatric patient. Put in your mind if you will notice any edema or abdominal distension, especially in pediatric, that means you are loading the child or the patient with extra volume, so you have to decrease the flow rate. Otherwise, it is better, and we are recommending to use the syringe pump or infusion pump when administering medication. In case you administer too much fluid to a patient, immediately you have to monitor vital signs of the patient, you have to notify the physician, and you have to assess breath sound. If you hear any crackles in the lower lobe of the lungs, then you have to place the patient in a high Fowler's position to ease breathing of the patient. Fourth systematic complication is air embolism. So how it is happen? Air embolism is a rarely encountered complication, but it is a much serious complication of some surgical procedure, which can cause harm and even death. Cases that involve central line have a greater risk for air embolism, but with appropriate precaution and technique it can be preventable. So what we mean by air embolism? This has happened when there is a sudden obstruction of blood vessels by air entering in the bloodstream, and as we said, it is mostly associated with cannulation of central line. So what are the signs and symptoms you may notice in a patient? Patient may complain of difficulty breathing, he may start coughing, and you may notice cyanosis. Patient may develop hypotension, syncope, or pallor. Then you may notice also patient is having weak rapid pulse, and later on the patient may lose his consciousness. Intravascular air embolism is a rare, serious complication resulting in significant morbidity and mortality, but it is a preventable complication. So how we can prevent this complication? You have to inspect all tubing for cracks or defects. Before administering any type of medication, you have to assess the administration set and make sure that there is no cracks or defect in the set. Then you have to remove all the air from administration set. Don't say this is only small bubbles. Small bubbles, then again another small bubbles, then it can accumulate and form very large bubble and can go and occlude any small vessels in the lungs. So you have to remove all the air from the administration set. You have to attach connection very tight. Keep a loop of infusion tubing hanging below the level of the heart, and you have to be very extra careful when using glass bottles. Why the glass bottles? You will notice that when you are administering a medication which is in a glass container, you will notice there is a lot of air bubbles in the glass container. So you have to stop the infusion before the set running of the solution. You are putting patient at risk of getting air bubbles with glass bottles. So before it is running out, all you have to stop it. So what is your nursing intervention in case you notice that the patient is having signs and symptoms of air embolism? Immediately you have to notify the physician. You have to stop the infusion, start to administer oxygen, monitor the patient, monitor vital signs, and keep all the emergency drugs nearby the patient. Fifth systematic complication we'll discuss is pyrogenic reaction. So what we mean by pyrogenic reaction? What is the pyrogen? It is a systematic febrile reaction caused by pyrogen being introduced into blood. How we are introducing pyrogen? Pyrogen can present in the infusion solution or container or the administration set. So before transfuse any medication to the patient or any IV fluid, you have to check the IV fluid container or IV fluid bags and make sure that there is no change in the colors of the fluid. There is no crack in the bag. It is not expired. There is no air bubbles in the solution, because the air bubbles in the solution, it is indicate that there is pyrogen. Also, you have to make sure that container or the administration set, it is new, not used before, and there is no crack in the administration set. While you are administer the solution, you have to follow sterile technique. You should not touch the tip of the administration set with your bare hands. So what are the signs and symptoms when we are saying pyrogenic reaction? That means immediate signs and symptoms you will notice in the patient is fever, because it is like an infection. So the patient may develop fever with chills, general malaise. Patient may complain of headache, backache, nausea and vomiting, and sometimes if it is not treated, It can lead to vascular collapse and shock. So how we can prevent virogenic reaction? As I mentioned before, you have to use and maintain septic technique when you are administering IV medication. Your hands should be clean, you should wear gloves, and avoid to touch the tip of the administration set or the tip of the container of the or solution bag. You have to maintain the sterility. Also, you have to change the administration set according to the institution policy. According to the MOH policy, the administration set should be changed every 48 hours if there is no additive in the solution. But if you add any medication like KCl, you add KCl to normal saline, then this is IV fluid with additives. At that time you have to discard the administration set after 24 hours. Of course, for blood transfusion, as we know, you have to discard the bag with the administration set. So the administration set should be used only for one bag. Then prepare IV solution as close as possible to the time they are needed. For example, you want to administer IV fluid like Ringer lactate for a patient. So if you want to start it now, then you have to prepare it now. Don't prepare, for example, 1 hour or 2 hours before administering to the patient. No. Prepare the medication at the same time of administration so that you will prevent any chance of decontamination of the solution or the IV administration set. In case patient develop virogenic reaction and you notice the signs and symptoms of the patient, then immediately you have to notify the physician. You have to stop the infusion immediately, but don't discard the solution bag or the IV set. Take the solution bag, the set, and send it to the lab to take a culture and make sure that is the cause of the virogenic reaction in the patient. Then you have to resite the cannula, you have to reinsert another cannula in the patient and keep IV open using another solution and another administration set. Okay, you have to administer IV fluid according to the doctor order by using another solution and another administration set. The one which was on the patient, you have to collect, put it in a bag, inform the doctor, then you can send it to the lab so that they can take a culture and make sure this is the reason for virogenic reaction that the patient had. Blood embolism is one of the systematic complications can happen to a patient because of IV therapy. So what we mean by blood embolism? It is a sudden obstruction of the blood vessels by a thrombus, primarily in the pulmonary arteriole. This clot can originate from thrombus formed within the vein or when there is a clotting cannula and forceful irrigation is used to clear it. What are the signs and symptoms? Immediately you will notice that the patient will have tachycardia, dyspnea, chest pain, hemoptysis or cyanosis. Even blood embolism, it is a serious complication, but actually we can prevent the complication. How? You have to prevent clotting of the cannula by preventing the container from running dry. Don't let the solution until it ends up. You have to close the clamp before it is running dry. You have to maintain adequate flow, and also you have to maintain patency of the cannula. Flushing heparin locks regularly. If flow has stopped, then you have to try to restore it by raising the container or open up the regulator clamp or remove the clotted cannula. Most important, if you are trying to flush the cannula and you will feel there is a pressure, please do not forceful irrigating the cannula, because there is a blood clot, and if you will do flushing with the pressure, then you are leaving that clot to go on bloodstream. So if you will feel any pressure, then try to aspirate the clot. If not possible, then you have to remove the cannula and reinsert the cannula, reinsert it to another place. In case blood embolism happen, then you have to notify the physician, keep monitoring your patient, and obtain emergency equipment nearby the patient. Catheter embolism is one of the systematic complications. This has happened when there is sudden obstruction of the blood vessel by a cut of tip the IV catheter or cannula. This occurs when a catheter piece or the tip of the catheter becomes dislodged and enter the general circulation and can dislodge any arteries in the heart or lung, which will lead to serious complication, and you may notice on a patient some signs and symptoms, like the patient will have tachycardia, dyspnea, chest pain, or cyanosis. It is a serious condition, but we can prevent. How we can prevent? It is a golden rule. Do not reinsert the stellate into the catheter cannula. When you are cannulating the patient, we are inserting both the catheter and needle in the vein. If it is unsucceed, you will remove the needle and you will observe for blood backflow. If there is no blood backflow, some of the practitioners, they will reinsert the stellate or the needle back to the catheter or back to the cannula, the plastic one. This can cause it will break the tip of the catheter. Then that tip of catheter can go in the circulation and dislodge any small arteries in the heart or lung. So when you are practicing venipuncture technique, you should not reinsert the stellate. Why? Because it may cause catheter embolism. So what is your nursing intervention of catheter embolism? If you witnessed cut of the tip of the cannula, immediately you have to notify the physician, and you can apply the tourniquet immediately above the insertion site. Why? So that you will prevent the immigration of the tip of cannula in the circulation. The patient will need an immediate surgical intervention to remove the tip of cannula. That is, if you witnessed the dislodge of tip of cannula. Then you have to monitor vital signs of the patient, keep all the emergency equipment nearby, and you have to follow doctor instruction. You have to document everything, and also you have to